Hi, my name is Mira Rastogi. I'm a psychologist and a board certified art therapist, and I'm going to talk about group art therapy and mental health recovery. Since I can't be here today, if you have any questions, please email me at the contact information you see on the slide, and I'll be happy to get back to you as soon as possible. So, the group I work with are those that would qualify as having a serious mental illness. They make up about 4% of the population, and the reason why I'm most interested in this group is because there are some pretty high consequences to the people who qualify as having a serious mental illness, as well as cost to our society in general due to healthcare costs, mortality rates, and loss of earnings. So, if you're not familiar with mental health recovery focuses on living a life with purpose and meaning, even if you do have a serious mental illness. And so the way that our treatment it focuses on empowering people, helping them develop their own sense of direction, developing individualized treatment, really providing a lot of peer support and focusing on strengths. And you can see the other elements listed on this slide. The group that I work with is at a community center, and they have the clubhouse approach, and it really is a supportive place where people with a mental health diagnosis or substance abuse diagnosis can go to gain support. The people who are employed there are peer support leaders, so really I am more of a volunteer member there, and we've just had this collaboration between the University of Cincinnati and the center for several years now, and the center's called the Hope Community Center for Mental Wellness. So art therapy is defined as a mental health profession that focuses on using art making and creativity and knowledge of psychological theory, in using all of that combined together in a therapeutic relationship. So you're using art as a way to enrich people's lives in a wide range of capacities, in a therapeutic relationship. And so researchers have argued that art therapy is more behaviorally active than talk therapy, that it really promotes a sense of confidence and mastery, that it helps people more easily approach things that they might be afraid of. It can enhance their personal identity when they may be able to see that they're good at a certain kind of art making, and creating together and doing group art therapy definitely creates social connectedness. And we all know how much social support, how much research shows social support is important and has many benefits. A comprehensive review of art therapy found that art helps as a coping skill. It really helps people express themselves and feel empowered. It enhances relationships, and that the skill of the clinician is really essential. So having some kind of background in both therapy and fine arts is really important, and that it did show positive outcomes as compared to control groups. So the session structure is, it's a free group that's open to anyone in the community, and it's open. So we have kind of rolling, people can come in when they want and they can leave when they want. The group has grown from 12 people a week to now 24, which is, an enormous group. And so I have started using students, undergraduate students who I train and supervise, to attend the group with me and work in smaller groups. So we have 5 small groups within the large group. And then there are also about 2 to 3 peer support members attending each group that helps. The group is 2 hours, and you can see how I've broken down the group, that there's an intro. We spend about an hour and a half making art and processing art and then cleaning up. And we focus on whatever issues arise within the group or what group members want to deal with, or we use the themes of mental health recovery. One example project is this one, where people had to create felt creatures of what they saw was their friend inside of themselves and what they saw was their enemy. And so people created felt creatures that represented parts of themselves that they saw as their enemy, parts of themselves that they saw as their friend, and then we could use those pieces to talk about those different aspects of our personality and how they can be used to help one another. So challenges of the group are that obviously the size of this group is very large. Interns are essential, and ideally the size of the group would be much smaller, 1/4 the size, but due to the nature of the community center and their mission, I've just adapted to what they are focused on. It also creates limited processing time. It might be better to have a 3-hour group. That would allow more time for discussion. I do ask that people work with their primary therapist and don't use the art therapy as a substitute for more focused individual sessions. And third, people have to be properly trained to incorporate art in their therapy. Just knowing how materials work, how they affect people, and really how to use the materials is very important. So if you decide you want to do this type of work, I strongly suggest either getting art therapy training or working with an art therapist, consulting with them. And then finally, it would be really great to do a formal assessment of people in the group. I've been a little bit challenged because several people lack reading and writing skills, but that's still in the works. The feedback is the size of the group has grown. We have an annual art show that we are increasingly raising more and more money each year. One of the members is now teaching her own art class, and you see a lot of confidence and patience grown in the group in dealing with each other, and it definitely has become a place of support. And you can see this member's drawing where she describes relaxing, making art with people at the Hope Center is one of the things she really enjoys and looks forward to every week. Thank you very much.